You know, if you've ever had a migraine, man, you know how nasty it can be, how debilitating it can be. If you suffer from migraines, but nothing eases the pain, your headaches may actually be a sign of something more. We have with us a doctor who specializes in these kinds of headaches. The treatment's pretty extraordinary. Dr. Randy James from Denver here. Board-certified Atlas
Orthogonal. That's
orthogonal.
Orthogonal.
What does that mean, orthogonal?
Orthogonal is a term that's borrowed from an architect that means at right angles.
Okay. And the Atlas?
The Atlas is this bone at the top of the neck that your head sits on top of. And
that is it. That is the source of so much. That
oftentimes it is. Not everybody.
Yes.
But for the people that have these headaches, now I'm not talking about people that just occasionally get headaches. I'm talking about these daily sufferers, the kind of people that are, it's not the pain that bothers them, it's more the fear that they're going to become symptomatic. They hate to make plans with anyone because they're afraid they're going to have another migraine or another headache.
So it's a small niche, but it's a serious one.
It's a serious one.
So describe your patient then before we get into the treatment.
Well, it's typically somebody that suffers or that's symptomatic with a headache event greater than 3 times a week.
Okay.
The pain that they experience is related to some degree to the neck. They've got pain at the base of the skull. It seems to start there. It wraps over the top of the head. It feels like a ram's horn and it sits behind the eye or radiates as far down as into the cheek. Somebody that's had a traumatic event happen, meaning they were in a car wreck, they fell down skiing, they dove in a pool that didn't have any water in it. You know, things like that. Something that would snap their head around and tear the ligament at the base of their skull.
Now, do you get people from car accidents, or is it something more that they've lived with?
Well, most of the time it's something that people have lived with because it takes time for all these symptoms to start. And then, you know, they're finally at the end of the rope. They feel like they've tried everything. You know, they've been down the drug route. They may have been to pain management, and they just feel like there's nothing else.
Now, we're going to take a look at this treatment because it looks extraordinary when you see it. It's very targeted. And if we can look at that video, this is what's really incredible, taken of you doing this. Now, you do an exam, too.
Oh, absolutely. Not everybody's got, you know, not everybody has this problem.
Now,
but if
what is this?
This is the device I use that's FDA approved to treat this problem. That fits right behind the ear, which is where this bone happens to be, way up there. This person didn't feel any discomfort by me doing that.
And it probes that, and
well, I've already determined by X-ray where this bone is in space, where this displacement is. You see this spine here. And I think it kind of will focus in. And
it pulses.
Yeah, that thing plunges down. It's like a hammer hitting a nail.
Wow.
It's more or less a sound wave that goes into the side of the neck and hits that bone. Now, that's what corrects this problem at the base of the skull. It's not something that I do just once. It's not magic or anything like that. I do see people more than once, and oftentimes it's a course of treatment over 6 weeks.
Now that is very targeted.
It is, and that's why you don't really need a lot of treatment. I mean, you know, in the grand scheme of things, if I see you for 6 weeks, it's not, you know, real frequently, but I'm done with you. You know, once this heals, we're not going to grow old together. You know, we discharge you if things start to come, if the wheels come off and you start getting worse, you come back in and see me. Well, so let me show you on the little spine. Do we have time for that?
Yes. Okay. That's extraordinary. You want to use a pen or something?
Yeah, please.
Okay.
All right. So this is this Atlas here.
Okay.
This is at the base of the skull. So this is the back of your head. When this bone shifts to the side because some of the ligaments torn here, all of these nerves at the base of the skull, these little yellow things, they become irritated. It's well documented that if you irritate one or more of those nerves, it creates pain at the base of the skull that wraps over the top of the head, and it can wrap down as far as into the cheekbone. By correcting where that bone sits in its position there, the muscles relax, the inflammation goes down, the nerves aren't as irritated, the frequency, intensity, and duration of the headaches or the pain that you're having is diminished. Not everybody is just headache-free, but I tell people, look, if this is 60% of your problem, would you be happy if 60% of your pain went away?
You took a very realistic approach.
Absolutely. I mean, you have to be. I mean, I want to manage people's expectations that this isn't, you know, sure, there's people that get all the way better. They never have another headache.
You've had people that totally gotten over their migraine.
But that's the exception to the norm. I would, you know, like I said, to manage expectations, that's not what is going to happen every time. But most people get enough of the desired benefit where they're happy when I'm done with them.
Yes.
And the people that get all the way better, I get their Christmas card.
And does the frequency diminish right away? The frequency of these attacks?
You know, the first couple, the frequency of the headaches?
Yes.
Yeah, that's what I want. I want you to be getting the pain and the headache less often. And when you have it, it's less intense, and it doesn't last as long. So we've diminished everything and shrunk it down to something manageable.
So, how we're going to talk about who's a candidate.
Okay.
And I think we have a graphic on this. And there's only 2 doctors certified to use this method in Colorado.
In Colorado,
you're one of them. And
only 2 board
only a
certified.
handful in the country. So what do we have here? Have pain in your neck that travels to your head.
Yes.
Had a neck injury,
like
either a car wreck or sports injury.
Yeah.
And even if you don't know where it came from, if you do have this pain or headaches and are afraid to have your neck cracked,
if you've ever thought of, you know, and if you've ever thought, boy, I'd like to try a chiropractor, but man, I just really don't want to have my head snapped around.
Right.
That's not that. We don't do that.
All right,
and then if you feel like you just tried everything, you probably haven't tried this.
No, and I think by looking at it, you can see how unique that treatment is.